Hi everyone, welcome to the Completing Required Substance Use Assessments and Documentation Training. My name is Melanie Elmore. I am the Co-Occurring Disorder Specialist here at Region 4. Most of you probably already met me at trainings that we've done at your offices. I just wanted to take a little bit of time and go through this presentation with you guys. I know some people were not able to attend some of the in-person trainings that we did. However, I thought this would be either a good review for those of you who have been to the trainings and just a way for you to catch up if you were not able to attend those. So what we'll be doing for the next few minutes is just talking about the different A&D programs and services that we offer here at Region 4. And then we'll talk about the documentation requirements for individuals with substance use disorders. There are a few differences, a few additional documents that need to be completed with those clients who do present with substance use problems. And then we hope to increase your understanding of the documentations and assessments. I want to go through just a few areas in each assessment where some people have some confusion. Go through and make sure everyone has a really good understanding of what is expected. So these are the 5 additional documents that are required for those individuals with substance use disorders. Just a quick note, the opt-out form for HIV testing is only required if the individual is not referred for HIV testing. And all of these are required in addition to the documentation that is already required for individuals with mental health disorders. So the client demographic section, just a few notes here for those clients who do have a substance use disorder. You'll want to choose alcohol or drugs for at least one of the presenting problems here. And for disability category, if they do have a substance use disorder only, you'll choose substance abuse as a disability category. Otherwise, if there is a co-occurring mental health disorder, you'll choose MHSA for dual diagnosis. There's also an option to choose MRSA for those individuals with developmental disabilities. You could choose that if they also have a substance abuse disorder. MHMRSA is also available for those with mental health disorders, IDD, and substance abuse disorders. For each of these items, we'll want to complete everything at intake with the exception of these that say discharge. So the discharge referral category, discharge referral organization code, and counting of residents at discharge are only completed after the client is discharged from services. So taking a look at the chemical dependency tab, this section should be completed for any client who does have a substance use disorder. There's only 4 items in this section. It's fairly straightforward, however, I just want to go through a few things. Mode of administration should always be administered by staff. It's asking who completed the forms, who asked the questions. Days waited to begin treatment should be number of days since referral was received. For those of you who work in programs where you get a number of referrals from outside sources such as probation, we can count back the number of days since you made contact with that individual. I know sometimes we get referrals and we may have trouble, actually getting the person on the phone. So we'll definitely want to count back from when we actually made contact. Number of prior A&D treatments. Here we're not going to include detoxification services, only actual A&D treatment counseling services. Don't include 12-step programs and other self-help groups here either. Prior treatment in facility, we never want to click unknown here. Just go in, and when you enter the client's name into the Essentia system, you'll see whether or not they've been in our agency before. So just click yes or no based on that information. Often the client will be able to tell you that as well if they've ever been to us for services. For program admission, an individual with a co-occurring substance use and mental health disorder should be admitted into both the mental health and the A&D programs. I know often clients are referred to us or come to us simply for the mental health symptoms, and we find out later during the intake that they also have a substance use problem. We'll want to go ahead and enroll those people in A&D services as well. Now, often we just put them in the mental health program because that's oftentimes the primary diagnosis. However, the problem with not admitting them into the A&D program is that it causes some billing issues. Some of the services, specifically the TBHIV STD education service, is only billable under an A&D program. Now we'll dive into the assessments that are required for all individuals with substance use disorders. Most of the assessments are found here under the substance use heading in our sub-assessments. There is an exception. The ACM tool that we will talk about in a few minutes is actually under the other assessments tab. I'll go through and show you specifically where to find that one. The first tab under the substance use section is the TBHIV STD Risk Assessment. Therapists should schedule 30 minutes for HIV prevention counseling following the intake appointment. This can be scheduled at the time of the referral if there's a known A&D problem. If they come in and you don't know if there's a substance use problem, you can go in and schedule that following the intake. This service is billable to a grant, so it doesn't matter if the client is self-pay or insurance. We don't have to worry about that covering the service because it is billed to the grant, which means that it's very important that we put them in the correct program. So you will choose one of the A&D programs, for instance, A&D Outpatient Adult. You'll go ahead and choose that program. And choose service code 00461 HIV Pre-Counseling MA30. That is the correct service code for this service. And you will include this on your timesheets as this service code 00461. So this is a look at the TB HIV STD Risk Assessment. For the first question, it asks for you to choose the correct form. In most cases, we are going to choose outpatient here if you're an outpatient counselor. The first 4 questions are asking about risk factors for TB infection. So if the individual answers yes to one or more questions, they are at high risk, and we're going to want to take steps to get them additional testing. The remaining questions ask about factors that place them at risk for HIV infection. If the individual answers yes to 5 or more of these questions, they're considered high risk. It is required that all individuals receiving services for substance use disorders do receive education about TB, HIV, STD transmission and prevention. This information should be provided to the individual following the risk assessment. And a TB HIV information packet can be obtained in the patient education section. So what you'll do is you'll go to the patient education portal in Essentia, and you'll see that this screen will pop up. You'll click Assign Document, and this window will come up, and you'll scroll down all the way almost to the bottom, and you'll see TB HIV information. When you click on that, it will generate here under description, and you can download it. And it'll download as a PDF that you can print, or you can choose to email it to the client. And it has information about TB, risk factors, prevention, HIV information. There's information about STDs and other good information that we can give our clients. So after you complete the risk assessment and have given the client the information, the educational information, you'll need to go through and complete this section. So for each item, items 50.20 through 50.26, you're going to be entering the date that you actually gave the client the information or completed the risk assessment. So just put the date in the box and click submit. We don't want to skip any items. So for the item where it asks when we provided HIV testing, if the client does opt out, you can click no here. And for the next item where it asks for the date, just leave that blank and click submit. If it makes you more comfortable, you can go under additional comments and just type in that the client refused testing. For tuberculosis risk assessment, item 50.31, you'll want to enter the date that you completed those questions. Click submit. And for the next item, completion of skin test, if the results did not indicate any further action, so we didn't need to make a referral for testing, you'll leave this blank and click submit. Again, you can type in additional comments that the client, there were no indication that they needed to be referred for testing or that they refused to be referred for testing, and click submit. There will be a document that generates in the clinical documents, and this does need to be signed by the individual. If the client opts out of HIV testing, they do need to sign the opt-out form, and this form does not automatically generate, so you'll need to go under the alcohol and drug documents and generate that form and have the client sign. And it's a very brief form, like one sentence. They just indicate that they were offered testing and that they opt out. I do like to, even if the client does opt out, go ahead and provide that information of where they can go to get testing. If they decide to do that in the future, generally it would be their general practitioner or the local health department. The next assessment that you'll need to complete is the substance abuse assessment. You can see that it is the second tab under our substance use documentation. It's a fairly simple assessment. It looks a lot like the regular intake assessment. It asks for background information, information about behaviors, frequency of substance use, family history, and so forth. Some of these will automatically generate from the intake assessment, specifically the family history. And a document will be generated in the clinical documents that needs to be signed by the therapist. It's important not to skip any items. This information will automatically generate into the MSAMIS, which is the next form that we'll complete. It just makes your job a lot easier if you go ahead and answer the questions here completely, then you don't have to answer them twice. Also, this information is helpful in determining problem severity, barriers to treatment, and helps us in developing an individualized treatment plan. So most of the items on the substance use disorder specific assessment are fairly straightforward. Make sure don't skip any items. Ask the client each question and record their response. However, I did want to take some time just to go through a few of the questions that may be a little bit more difficult. For this item, substance problem code 1 of 3, you're going to choose the appropriate substance that the client identifies as the primary problem. What I like to do is go ahead and ask the client about each of the substances and substance categories listed. That really helps them to identify all of the substances that they are using. Specifically when we think about prescription medications, Sometimes people don't consider those substances that can be abused, so it's often helpful just to go ahead and talk about those with the individual so they're giving us the most accurate information possible. After you choose a response for this item, another window will open detailed drug code, which is item 61.6, and there you're going to choose the closest substance possible. Some of these are more categories, so we look at other sedatives or hypnotics, other tranquilizers, opiates, and synthetics. Those are more categories. So in the next window, it's going to ask you to choose a more specific substance. And we definitely want to avoid more general categories when possible, just so that we have the most accurate information. Also, don't be afraid to use the additional comments box to give even more details. So after you've completed all the questions for the first substance, you'll see item 61.12 was asking about a second substance. So here it says item 61.12, second substance, yes or no. Where it gets a little bit confusing is if the client does not report a second substance, you will still click yes. Do not click no. And then you'll be asked to answer the remaining questions about specifics about that substance. Never click skip. We're always going to click not available. For the substance problem code 2 of 3, you click not available. And then substance problem code 2 of 3, when the next item pops up, 61.14, you'll click not available. You can write in the additional comments box that the client reported no substance use. You'll do the same for the third substance. So if there is no third substance that's being used, you'll click yes. You can type in the box, there is no third substance. Then you'll click not applicable, not applicable. For last use, you can leave that blank and click submit. Amount of use, you can leave that blank. You can also type in none if you're more comfortable with that and click submit. Frequency, not applicable. Usual route of administration, not applicable. So I know this is a bit confusing. This is the look I tend to get anytime we talk about this. However, it is important that we follow these steps. This information will be generated into our next document, which is actually our state reporting form. If you do have any questions about this, go ahead and email me, give me a call, and I'll be glad to walk you through it. I'm also going to attach a link to a guide that will take you step by step through this process so that it'll help you remember when you're actually going through. So for the next question, item 61.28, it asks if you need to add another drug. It's asking, is there a fourth substance? For this one, you can choose no. It's okay to click no if there's not another substance. If there is, you can click yes, and it's going to take you through similar steps, asking you to specify what drug it is, frequency, age of onset, and so forth. In item 61.107, recovery needs, this one can be a little bit confusing as people don't really understand what it's asking for. All it's asking is which services are needed to support that individual in recovery. So it can be things like individual therapy, group therapy, family therapy, community support services, recovery support, peer support, etc. Go ahead and enter that in the comment box and then click yes. Treatment service, we're going to choose the most appropriate service that's needed. If the individual needs to be in intensive outpatient, we need to make a referral to that. We click there. If they need to be in residential, we can click there. And if they need outpatient, we would click outpatient. The next document that we'll complete is going to be the MSAMIS. So according to the Mississippi Department of Mental Health, the Mississippi Substance Abuse Management Information System was developed to provide current information on consumers and the treatment provided to them in order to aid in the planning, management, and evaluation of substance abuse treatment programs. So you are required to complete this form at intake and discharge for all individuals, adults and children, who are diagnosed with a substance use disorder. This form is very important. It's very important that we complete this accurately and completely, because this is how the Department of Mental Health knows how many people we're treating who have substance use disorders. This is how we get grant money. This is how we get funding for our programs. So if we're not accurate or reporting, we're not getting credit for the number of people that we're serving. It also gives us outcome information when we complete this at discharge. So we know how well people are doing when they come through our programs. This will be the third tab under our substance use section. As you can see, a lot of the questions will be generated from that substance abuse assessment. So you won't actually need to do this twice. So at intake, you'll complete items 1.0 through 1.28, and you can do this when the client is not present. You should have all of this information from your previous assessments with the client, so you can take a few moments after the client leaves just to go through and answer these. You do need to answer each question, and don't click unknown if at all possible. I know sometimes at discharge, if the client for some reason stopped attending services and we haven't had contact in several months, it may not be possible to know some of the answers, so you can click unknown there. However, at intake, it's very important that we go ahead and answer each if we have that information available. We never want to click skip. So at discharge, we'll need to complete items 1.29 through 1.47. So what you'll need to do at discharge is start a new substance use assessment and click populate with current master assessment answers, and that will generate all the information that was entered during the intake assessment, and you can just go in and add these answers. The next assessment that we complete is the American Society of Addiction Medicine Criteria Assessment Tool. So if you haven't heard about the ACM helps us to determine the level of care by assessing the individual's functioning in 6 dimensions. And these 6 dimensions include acute intoxication and withdrawal potential, biomedical conditions and complications, emotional, behavioral, or cognitive conditions and complications, readiness to change, relapse, continued use or continued problem potential, and finally recovery or living environment. This is going to take a brief few moments to go through each of these so you have an idea of what we are looking at and symptoms and things we may be looking for when assessing these dimensions. So acute intoxication and or withdrawal potential, we're looking at, is that individual at risk for severe withdrawal symptoms? Or are they acutely intoxicated? Are they intoxicated when they're coming into the intake assessment? Are they frequently intoxicated? To where we're really not able to determine, if they're going to have withdrawal symptoms or not because they're, usually intoxicated. Biomedical conditions and complications, we're looking at physical health problems that need attention. If a person is having a severe health problem, we're definitely going to want to seek assistance with those and treat those symptoms before we look at some of the mental health symptoms that may be present. Emotional, behavior, or cognitive conditions and complications. We're looking for, we're looking at individuals who may have very severe mental health problems that may need to take precedent over any other symptoms that they may be experiencing. Readiness to change, we're looking at how much they have accepted that they do have a problem, if they're willing to work through a treatment program. Relapse, continued use, or continued problem potential. We're just looking at, are they frequently relapsing? Are they at high risk for relapse? Or are they continuing to use even though they're in a treatment program? And then finally, we're looking at the recovery and living environment, looking at factors such as, the people that they're spending their time with, whether there's drug users in the home, and just how much support they have in their environment to support recovery. So when we assess for these factors, we're looking for situations that would make being in an outpatient program not suitable for that person. If an individual has risk for serious withdrawal problems, specifically with alcohol, opioids, substances that cause very severe withdrawal symptoms, it may be necessary for them to go into a detoxification program before they enter into a substance use treatment program. And obviously those individuals would not need to be in an outpatient program. With our emotional, behavioral, or cognitive conditions, it may be that those symptoms are more severe than the substance use symptoms, and they need to be in a program that specializes in stabilizing those symptoms before they go into an A&D focused program. With readiness to change, it can really go both ways. So we may be referred a client maybe from probation who doesn't really see that their substance use is a problem. They're sort of at a low stage of change. Maybe they're in pre-contemplation. For those individuals, sometimes if they are at risk for danger caused by their substance use, if their substance use is putting them in harm's way, then we would want to put them in a higher level of care. However, for some individuals, it just would not be helpful to place them in a substance use program at that time. So we would want to spend some time with them, help them to sort of move into a higher state of change before we place them in a substance use treatment program. So next we'll go over our next required assessment, which is going to be the ACM tool. The ACM tool is actually found under the other assessment tab. We'll see it here. The tool contains a series of yes or no questions which assess all 6 dimensions that we just talked about. It can be completed without the individual present because these areas are addressed during the intake assessment and substance use specific assessments. So you should already have enough information to accurately answer these questions. I will encourage you to go through and read the questions just so you have an idea of what you're looking for when you're doing your intake assessment. So as you can see, after questions are asked for each dimension, the clinician must designate whether the individual is appropriate for outpatient level of treatment. So if you take a look here, item 59.0, intoxicated high during the assessment. 59.1, current withdrawal signs. 59.2, have you ever been told that you have a positive HIV test? 59.4, history of severe withdrawal symptoms. 59.6, appropriate for outpatient level of treatment. So based on the answers for these items, you'll determine whether or not the individual can be treated at the outpatient level of care. And this question is actually asked following each section. You will need to generate a document for the clinical records. Some people say that it'll generate it when you save the assessment. Otherwise, you can pull this in the client's clinical records, and it's found under the alcohol and drug forms. It says MCOSA ACM assessment. Just brief information on treatment planning. I know most of you have attended a treatment planning training. If not, you're probably scheduled to attend one. We just want to make sure that goals and objectives related to substance use problems are included on the treatment plan, along with those goals and objectives related to mental health problems. The general rule of thumb is to have one goal for each diagnosis that the client has. And then, the appropriate objectives, one or two, usually is what's necessary. And remember that our goals should be measurable, should be things that the client wants to work on. Goals are generally in the client's words, where the objectives are more clinical. And be sure to include services related to substance use as well, so just peer support and recovery support. Recovery support and peer support are valuable services which we offer. I know some of you may not have access to this service. However, if you do have a peer support specialist available for your program, I do recommend that you enroll the clients in that service. It's very helpful and just offering an extra support to individuals who are working towards recovery. Also on the crisis support plan, remember for those individuals who are diagnosed with substance use disorders, potential crisis related to substance use and or relapse should be reflected in the crisis support plan. Often we think about suicidal thoughts, aggression, things like that when we're making our crisis support plan. However, there is a very real risk for relapse when we are working with individuals diagnosed with substance use disorders. So it's very important that we include steps that they can do if they find themselves relapsing or at risk for relapse. Just ideas for action steps include attending 12-step meetings, finding a sponsor, calling a support person, etc. We really want to encourage people to reach out to supports available in the community so that once they're discharged from our services, they know who to go to. These are just the references that I use. You can access these on your own.